Cases of monkeypox,
meantime, continue to climb in San Francisco. In fact, the city is seeing more than a 70% increase in just 1 week. Last week, this time, San Francisco was about 222 cases. Today, that case number stands at 386. And while criticism continues that federal health officials are not taking this seriously enough, the allotment of vaccine San Francisco is getting will be doubling. Front 4's Dan Kerman reports.
Long lines outside San Francisco General Hospital again early Tuesday morning to get the monkeypox vaccine. 650 shots were dispensed Tuesday, and there will be more available on Wednesday. Even better news, San Francisco has confirmed their next allotment of doses will be over 10,000, nearly double what they received last Thursday.
We are excited to get any news that there will be more allocation of vaccine coming into the city.
Tyler Termier heads up the San Francisco AIDS Foundation, one of the community partners that will get a portion of that allotment to dispense to its 10,000-person waiting list. While he says this is a great step forward, he says the federal government still must step it up with vaccine distribution.
There's a window of opportunity for us to use the tools in our tool belt, vaccination being one of them, treatment being another, to ensure that we can stop the spread of monkeypox, but that window continues to close when we are having barriers to treatment and when there's not enough vaccine to respond quickly.
Earlier in the day, Termier slammed the feds while taking part in a virtual news conference by the National Coalition of STD Directors.
We are once again in a moment where a lack of urgency and an inadequate response has left our community filled with fear, unanswered questions, and valid outrage. A moment where we have been abandoned by inaction.
The coalition has called on health officials to declare a federal health emergency immediately.
The declaration of a federal public health emergency will help alleviate some of the problems we currently have, but resources must follow. Congress must act quickly to approve the $21 billion pandemic preparedness ask, of which the White House indicates that as much as $7 billion may need to be devoted to MPV.
Last week, San Francisco ran out of monkeypox doses. It's unclear whether that will happen again or whether this new allotment will arrive in time. In San Francisco, Dan Kerman, Crown 4 News.